Moving on to 18. 18 reads, a client with chronic asthma is admitted to the post-anesthesia care unit, or PACU, complaining of pain at level 8 of 10 with a blood pressure of 124/78, pulse of 88 beats per minute, and respirations of 20 breaths per minute. The PACU recovery prescription is morphine 2 to 4 milligrams IV push while in recovery for pain level over 5. What intervention should the nurse implement? A, give the medication as prescribed to decrease the client's pain. B, call the anesthesia provider for a different medication for pain. C, use non-pharmacologic techniques before giving the medication. Or D, reassess the pain level in 30 minutes and medicate if it remains elevated. All right, another big question, but great question here. So what's it asking us? What intervention should the nurse implement? Simply asking us, what are you gonna do? What do you do, right? What's our problem? We have a client with chronic asthma. Oh, what's that? That's right, client descriptor. Here it is, calling out a very specific person for us. So client descriptor, a client with chronic asthma. So they're in the PACU, they got pain, pretty high, 8 of 10. Blood pressure 124/78, that's fine. Pulse 88 a minute, cool with that. Respirations 20, nice. And we have an order for morphine 2 to 4 milligrams IV push if pain's over 5, and it definitely is, right? So with the exception of the client's pain, everything else is normal. Blood pressure's fine, pulse is fine, respirations is fine, right? We have an order, but they're in a lot of pain, right? So it's asking us, what do we do here? Let's think about our outcomes and pick a solution for our client. A says, give the medication as prescribed to decrease the client's pain. That seems simple to me, right? But what we know with our toolkit items is when we see these client descriptors, remember, we're looking for something that is specific to this client. Otherwise, it is not important to know this person has chronic asthma. Why? Who cares? What does that have to do with the pain, right? So there's a reason why client descriptors are in the question. Make sure that you keep that top of mind. So give the medication as prescribed to decrease the client's pain. Yeah, but like, what's the deal that they talked about asthma? We have to think about that. What does that have to do with giving them medication? Oh, are we remembering? Yeah. Morphine is a histamine-releasing opiate. And so somebody who has chronic asthma, this can cause them to have a histamine reaction and an airway reaction, bronchospasm, and wheeze, and they can have an asthma attack, right? And that's not good. That's not good. We don't want that to happen. So let's not give them the morphine. We don't want that outcome. B says, call the anesthesia provider for a different medication for pain. Yeah, let's keep that because we got to fix this 8 out of 10, but not with the medication that could cause them to have breathing problems. C says, use non-pharmacologic techniques before giving the medication. Non-pharm, okay, great. We're down with that. But before giving the medication, no, we're not going to give this medication. And D says, reassess the pain level in 30 minutes and medicate if it remains elevated. Well, guess what, folks? If you come back in 30 minutes, this 8 out of 10 definitely is going to be elevated. And we're not going to medicate them with the morphine. We're not going to do it. So let's get rid of that one. So B is our correct answer. Call the provider. Let's get a different medication for pain. Now there's something else happening in this item. And did you see it as we work through? A, C, and D. These are copycat answers because the outcomes are the same. In A, they're gonna get morphine. C, they would get morphine. D, they're gonna get morphine, right? So those are copycat answers. And in that way, we know, eliminate that. When we have 2 or more that give us the same outcome, get rid of it. Get rid of it. Good job on that, guys. Okay, let's move right along.